Hey guys and gals, it's Dr. Marcy with a little bit of clinical research on the disease mortality risks with low testosterone. So in a study published in 2006 in the Journal of Clinical Endocrinology, done at the Institute of Reproductive Medicine at the University of Damascus in Münster, Germany, they reported findings that the mean, was 650. At 600, they saw an increase in mortality risks by 28%. At 450, 48% of study participants developed type 2 diabetes. At 432, there was a loss of libido and fatigue. At 332 to 380, coronary heart disease. At 300, we started seeing depression and mental health disorders, including increased risk of suicidal ideation. And at 231, permanent erectile dysfunction. If we know that having testosterone below the level of 600 increases the risk for mortality, and the upper limit is around 1050, without any significant issues in health, why are we not treated until 600? Also important to note in the study, at 900, they started to see an increased risk for Alzheimer's disease at about 10% of study participants. And at 840, there was an increased risk for prostate cancer. So if you were below 840, why are we not supplementing until somebody gets below 400? Metabolic syndrome started at 770, and metabolic syndrome is not just weight gain or obesity. Metabolic syndrome is the liver not working right, the adrenals not working right, the thyroid not functioning right, cellular changes in the blood vessels. There are some men who, even with testosterone supplementation, suffer erectile dysfunction when they are at 1,000. Why is that happening? Well, it's because they dropped below that and no one's actually fixed the metabolic health. So in order to correct erectile dysfunction, we have to correct the metabolic health that was declining when they got to 770 as their level. And when they were down below 400 and you didn't decide to treat until then, you caused a problem.